32 states have passed telemedicine parity laws, which state legislatures are forcing insurance companies, private insurance companies, to pay for telemedicine services. And these services are otherwise already covered for a patient when they're seeing a doctor in the office. So they're trying to make it equal. In other words, if a doctor is paid for a service that is conducted in the office, he should be paid for that service that's done through telemedicine. That's the debate at hand.
So people might be listening to this and they're saying, well, wait a second, that kind of sounds like a good thing. Let's just make this an equal payment. So why isn't it?
It seems like it's an incentive for more providers to adopt telemedicine, because with current evidence, it can be cost effective, and it's very it's convenient for patients, especially those living in rural areas, which we will talk about in a little bit. But in reality, it can lead to a slippery slope, because when you look at telemedicine, there's three types of telemedicine. You have virtual services, where you can have an online live consultation with a doctor through your phone or computer. Then there's asynchronous. There's store and forward, where a patient can take a picture of a rash on their phone or computer, send it to a doctor to review later. Or there's also remote patient monitoring, which is where hospitals can look at patient vital signs who are located in another hospital if there's a shortage of providers in that area. So it leads to a slippery slope, because if you make health insurance companies cover one type of telemedicine, it could have them ending up being forced to provide and cover other types of telemedicine. So it limits the freedom for insurance companies to provide telemedicine services or include those benefits in different health plans how they want to.
So, Katherine, if North Carolina continues to not adopt a telemedicine parity law, does that somehow mean that those of us who live in North Carolina and need a doctor or need some sort of service or care, that we're getting shortchanged somehow?
No, because to the extent that telemedicine is already working, to the extent that the market forces are working with telemedicine, it's a multi-billion-dollar industry globally. There are so many startups in North Carolina that are homegrown in North Carolina. RelyMD is one telemedicine app that was created by a large emergency physician group in North Carolina, and they offer online consultations for $50 out of pocket. So I think that embedding this service in your health insurance package, where health insurance companies are forced to, it sort of undermines the point that basic primary care, when delivered through telemedicine, is also affordable when paid for out of pocket. And so that also shields consumers from the actual price and cost of healthcare, which really is just adding to the problem of healthcare price transparency.